inflated in the patient, or aspiration pneumonitis in the patient. So it's important that, especially in the critical care units, and some of the complications I said the other time, that's aspiration. Hello friends, my name is David. You can call me David the nurse. I'm a critical care nurse and I welcome you to my YouTube channel. In this channel, I will be sharing very educative content with you, and please, I want you to subscribe to this channel, share it with your friends, and then like it, so that subsequently you will get notifications of the videos that I will be making on this channel. I will be talking and sharing with you knowledge in the acute care setting, especially in the critical care units. And in this video, I want to talk about one of the instruments that we use in the intensive care units, and it is called cough manometer. The cough manometer is an instrument that is used to measure cough pressure. So very quickly, I'll be discussing briefly what cough is and cough pressure, and then the cough manometer. In the ICU, we give ventilatory support to patients, and we do this through the intervention of artificial airways. Some of the artificial airways, the commonly used one in the ICU is the endotracheal tube and tracheostomy tubes. Now, these tubes come with coughs. Some are coughless or uncoughed, but I'm talking about the ones that have coughs. Now, the coughs they are like a balloon located at the tip end of the tube. So when you pass the tube into the patient, because it's invasive, it goes into the trachea of the patient, and then patients can get some air, to breathe. It's important that the cough is inflated after the tube is passed to the patient. And the reason is that the inflated cough helps to provide a seal between the tube and the walls of the trachea. Now, when you pass the tube into the patient, the tube will be located in the trachea. There is a space or gap between the tube and the wall of the trachea. So this cough, when it's inflated, it helps to form a seal over that space. And the reason is that peradventure patients regurgitate or vomit, the food particles will be prevented from going down into the lungs of the patient, or even secretions from around the trachea will be prevented from going down into the patient's lungs, and this will prevent aspiration or aspiration pneumonitis in the patient. So it's important that the cough is inflated in the patient. The second reason why it's important for the cough to be inflated is that patients who need positive pressure ventilation, they must have their coughs inflated, because when the cough is inflated, it will prevent the leakage of air. So for instance, if you push air using your ventilator, if you push air into the patient, you provide a positive ventilation for the patient. The air, because the seal has been formed by the cough, it will prevent any leakage of air out of the patient. So it's very important. Now that we have established that the cough is important, and it's important that the cough is inflated in the patient, it is also important that the cough pressure is measured, because there are two tendencies. The cough can either be underinflated or overinflated. If it is underinflated, it can lead to some of the complications I said the other time. That's aspiration pneumonitis, and then it can also cause easy displacement or dislodgement of the tube, because if the cough is inflated, it also helps to secure the tube. It helps to secure the tube. So if it is underinflated, the tube can easily get dislodged from the patient, and then that's an emergency, because you have to look for other alternatives to secure airway for the patient. So it's important that we take the measurement of the cough pressure in the patient. Now, the other side is that the cough can also be overinflated. Now, if it's overinflated, it means that it exerts so much pressure on the tracheal wall, and that can lead to a lot of things. It can cause tracheal necrosis, tracheal stenosis, hoarseness of the voice. That's even long after the tube has been removed. It can cause sore throat and other complications like that for the patient, which we don't want. So the cough manometer is one of the safety precautions in the intensive care unit. So let me come to the instrument proper now, cough manometer. I will talk about different parts of the cough manometer. The first part is the handle. We call it a rubber bulb handle. It looks like a bulb, okay, and it's made up of rubber, so that's why the name is called that way. And then it is a part that you use in handling it. Now, this rubber bulb handle is used to inflate the cough. So when you measure the cough pressure and you discover that the pressure is low, you can use that rubber bulb handle to inflate it to the desired pressure that you want. Okay. The second part is a pressure release valve. That one is located at the back of the instrument. The pressure relief valve performs the opposite function of the rubber bulb handle, in the sense that it is important if the pressure is too high. So if you measure your cough pressure with your instrument and discover that it is too high, you can just press the pressure release valve to release the pressure, to reduce it to the level that you want. Now, another part, that the third part I'll mention, is a lower connection. Now, the lower connection is like a nozzle. That is the part you connect with the tip of the pilot balloon of the tube. Now, let me say something briefly about the pilot balloon. The pilot balloon is a part of the artificial airway that I mentioned the other time. That is the endotracheal tube or the tracheostomy tube. When you pass the tracheostomy or endotracheal tube into the patient, the cough goes into the trachea, but outside you have the pilot balloon. So the pilot balloon tells you the condition of the cough within the trachea. So if the pilot balloon is deflated, it means your cough is deflated. You can't see the cough now since it is inside the trachea. So your pilot balloon tells you the condition of the cough. If the pilot balloon is inflated, you are rest assured that your cough is also inflated. So it is the tip of the pilot balloon from the tube that you connect to the lower lock. Lower is L-U-E-R, or the lower connection on the cough manometer. So when you connect it well, you fix it, attach it well, then we now have the third part of the cough manometer is the face. That face is rounded. It's like a clock, like a wall clock, okay, and then it has a needle like the hand of a clock. So when you connect the lower connection with the tip of the pilot balloon, then it rotates to the level of the cough pressure. Okay, now that is where you take your measurement. Now on the face, there is a safety zone labeled in green color, or painted in green color, to tell you the safe zone of the cough pressure. So if the needle rotates beyond that point, then it means that your cough pressure is too high. If the needle goes below that red line, or that green color, it means that your cough pressure is too low. Then you can regulate it. Remember, if it is too high, you can use your pressure release valve at the back of the manometer to reduce it to the level you want. If it is too low, you can use your rubber bulb handle to inflate it to the level that you want. I hope you have learned something from this lecture. I'm excited that you are learning something new. Please don't forget to subscribe to this channel, like it, and share with your friends. I will post some other videos some other time. Please take care. Thank you. Bye.